going back to this particular development, which is we have started beforehand in the first lecture class, cardiovascular development, which I beginning of the session I said that it is kind of little bit complicated compared to this particular general embryology is there. All the embryological content is little bit complicated. It needs some kind of like a time and understanding this particular process of this developmental procedures, how it is going on and how this particular thing is evolving. And it is a continuous process. It is not like something is developing and something is not, it's not like that. It is a kind of like series of things keeps on, just like the traffic as it is moving in a busy street. So, everybody is making some kind of movement and it is going on. It is a kind of continuous streaming movies. So, it is going on. So, we just like take a slice and see this particular thing how it is going, but it is not that that is the only thing which is developing, that is the only thing that is happening. At that same point of time, so many things are going on. It is the 3-dimensional, 4-dimensional, 5-dimensional things which is going on that particular point during this developmental process. We only get an aspect of the 2D things which you are seeing here. So, it is a kind of like so many dimension converted into 2D, and that makes this particular content difficult to understand, comprehend for us. So, I am just like trying to make this particular thing as simple and as streamlined and as necessary element is required for your undergraduate learning, which I am just like bringing it in terms of like cardiovascular development. And this particular cardiovascular development, which have a quick recap of the things that we learned in previous things about. We learned this particular heart to be developed from this particular tube, we call them as endocardial tube. So, this particular endocardial tube, two of them are there initially joined by this particular bridging branches, makes this particular single tube, and this particular single tube goes on series of constrictions and dilatations and evolves into a structure which is resembling like this, and this particular series of constrictions and the dilatations have got individual names, and from this particular individual series of constriction dilated portions which you are seeing here is going to get to us to the future heart that we have. So, this particular series of constrictions and dilatations have a particular name. This is an arterial side, this is a venous side. The lower side we call them as sinus venosus. This sinus venosus have got 2 horns, we call them as right horn and the left horn of the sinus venosus, which is going to end to this particular primitive atrium, which is going to this particular primitive ventricle, and then we have the dilated part, we call them as bulbus cordis, and then we have the arterial end. Then we just like magnified this particular bulbus cordis into this particular part, which we call as truncus arteriosus and the bulbus cordis, and this particular truncus arteriosus which we have broken down into smaller parts like upper third, middle third and the lower third of this particular element, we call them as upper part is truncus arteriosus. Then we have this bulbus cordis, the middle portions of this bulbus cordis which you are seeing in the green, we call them as conus cordis, and then we have this unnamed lower part, then we have the primitive ventricle, then we have primitive atrium, and downside will be the primitive sinus venosus. Now, we have learned this particular bulbus cordis, the lower part which is in blue as you are seeing here, going to give rise to this particular smooth part or smooth outflow part of this ventricle system. So, if you just look into this particular chambers of the heart, as you see that this particular ventricle side which you see here, this outflow part is smooth part, and this part we call them as rough part, trabeculated. We have these ridges, bridges, papillary muscle existing on it. So, this smooth part of ventricle we call them a smooth outflow part, both are coming to this particular pulmonary artery and this particular aorta on this ventricle side, right side and left side. They are coming from this particular convoluted structure, we call them as lower smooth part, lower part. So, from this part blue region, this what develops into the smooth outflow part of this particular ventricle, and a smooth bulbus cordis develops into smooth outflow part of this particular ventricle system. This particular green part or this particular sky blue portions which you are seeing here is going to from this particular right ventricle rough part, and this particular yellow part entire thing is going to form this entire rough part of the left ventricle. So, this is what we have learned. So, from this particular tube we are getting to this particular shape of the heart developed from this particular grooving out here. What you see here, this particular tubes shows some flexure or bends, which we call them as flexure. So, we have this particular bend in between this bulbus cordis and this particular primitive ventricle. We call them as bulboventricular sulcus. So, this particular bulboventricular sulcus from this point deepens down and pushes this particular ventricle to this downside forwards and anteriorly. So, as a result of this ventricle with this flexion or bending, this particular ventricle moves anteriorly, moves downwards and moves forward. As a result of that, this primitive atrium moves backwards, moves up, and the sinus venosus also climbs up and goes on the posterior side and above. And this particular sinus venosus and this particular atrium, which is primitive atrium, together makes this particular atrial chamber, right side and left side, and this particular ventricle, primitive ventricle with this particular lower part of conus cordis and this particular lower smooth part of this bulbus cordis, that makes this particular ventricle chamber which is present in. So, we have learned this far about this particular looping or this particular flexions. So, how this particular thing is going down and bending, which is the normal thing which is going on. If you have a reverse thing happening in this particular flexion or the bending, instead of it is going down, if it is happening in the left side or opposite side, we have a dextrocardia or the different positions, or right side heart we have developed. So, again we are coming back to this particular same region where we have started and where we are going to talk about. So, we draw this particular simple diagram of this particular constrictions and dilatation. So, we have this particular thing, we call them as truncus arteriosus, then we have this next bulge, we call them as bulbus cordis, then we have this particular thing coming back which is known as the primitive ventricle, and then on we have this primitive atrium which ends into this particular chamber sac like dilated portions, we call them as sinus venosus. So, this particular element we have learned over period. So, this is the atrial side or arterial side, this is we call them as venous side. So, this simple diagram you should be able to produce and making some sense about this particular dilated and constricted part. Now, out of these particular constrictions and dilatations, we have to focus in few elements which is the next class for us, or which is this class which you are coming in. So, we have this particular flexure or the bend which is present in here, we number is at number 1, we call them as bulboventricular sulcus. So, we have this bulboventricular sulcus, and then we have this primitive ventricle and primitive atrium. In between them we have number 2 bend or sulcus is there, which we call them as Atrioventricular Canal, AV canal in short. So, these two elements we have to keep in mind. The third one which is present in here, which is number 3, which is present between this sinus venosus and the primitive atrium, we call them as sinoatrial canal or groove. So, these three are important to us. We have already seen this particular bulboventricular sulcus, how this is developing into this particular thing grooving, making this particular curvature which is leading to this particular thing move anteriorly, forward and downwards, and making this particular ventricle to move here. That's the thing we have talked here. Now, this particular bulboventricular sulcus which is present in here, which is the future side of interventricular foramen. That means this particular region, as this particular thing switches and as this particular thing bends, comes into a region where we have this particular thing present in here, which is going to form this particular interventricular foramen. That means between this particular right ventricle and the left ventricle, this particular space is gonna be. Now, this is what we have learned. Now, this is again we are focusing into this particular channel, which is number 2 channel, which is present in here. which is called them as atrioventricular canal. That means it is lying between the atrium and ventricle, that is going to form this atrioventricular groove. Now if you go by this particular heart, we have this particular heart present like this, and we have a groove in between this atrium and this ventricle. We call them as AV groove. That AV groove where you have the back side is lodged with this particular coronary sulcus or coronary sinus. So that particular groove is present in here. So this particular region, AV canal, is going to represent to this particular space. We call them as AV groove or this region. So our story starts here. So we get this particular heart having a single chamber developed from two tubes and having these particular things in a single undivided chamber. Now what we have to do out here is that we have to develop chambers into it. That means we have to develop 4 chambers inside this particular intercavities of the heart itself. So we have to make this right atrium, right ventricle, left atrium, right ventricle. So this is what we are coming in here, is this part of the class is that formations of these ventricular and atrial partitions, which call them as septums, which is for the today's class. So for this class we are going to talk about this particular element is we have to make this particular heart from a single chamber to 4 chambers. So that's what we are going to form this. So we have to create some separation between this atrial side and the ventricular side first thing. Between atria and ventricle we have to decide first. Then if you have decided atrial side and the ventricular side, in between them we have to make a partition between the right side and the left side. So that it makes right atrium, right ventricle, left ventricle. So we have to make and develop these particular things. So this is we are going to do in this particular class. So let's make this particular thing first about formations of the chambers within this or within these particular elements of this region. So we take this particular element, we call them as AV canal. So assume that this particular AV canal, this particular region is future in this region. So heart already have made a bend, and this particular region which is present between the above atrial side and ventricle side between. So then what we have to do, we have to define or make this particular divisions between the atrial side and the ventricle side first. So for that we have to make some kind of partitions in this region. So in this region is a partition which you are going to form at this particular level. We call them as AV canal. So if you see this particular AV canal, which is a circular or semicircular canal like this. Now if you are on the cavity of the atrium and looking into this particular ventricle side. So you are here, and from here you are looking into this particular side. So this is atrial side and you are going to look to this particular side which is present on the ventricle side. So from atrial side to the ventricle chamber you are looking in. So what happens out here, we develop some kind of mesenchymal tissues. That means some mesodermal element comes here which is making this particular element in here. We call them as cushion. So there are some kind of bulge comes in here. So we have some kind of mesenchymal cushions which is developing in here. So we call this particular cushions as AV cushion or atrioventricular cushion. So this particular cushion, as it is developing from this particular 2 walls or lateral or superior or inferior wall, inches with each other and comes close, and eventually they unite and fuse together and makes this particular things bridged over here. So this particular cushion we call them as endocardial cushion, developing from this AV cushion to this particular endocardial cushion joins together, makes this particular cavity divided into right half and left half. So this particular AV region over here we develop or we get a partition develops at the first time. So this particular endocardial cushion which is also present in between this region which develops in this particular region over here. So this particular element which is a first step of separation of chamber formation. So, this particular thing which is the septum formation or septum formation number 1. Now, as you can see, this particular, once you have these things placed in between this particular atrial side and ventricular side, and this particular atrial and ventricular side can be divided off into right side and left side, and this particular endocardial cushion or endocardial cushion which is placed in here, it looks like something like this. So, we have a cushion develops in here which makes this particular heart develop into above and below, right and left. Soon after, this particular cushion develops into formations of this particular valves in here. So, we have some kind of valve proliferates in here and develops into this particular region as atrial side and ventricular side, and these valves we call them as AV valve. Right side it has 3 cusps, left side you have 2 cusps, bicuspid and tricuspid cusp. So, this is how this next things which develops. Now, then comes easy thing for us is that we have to make some kind of partition from here to here, joining between them to make this particular atrial chamber separated. That gets this particular atrial chamber separated into this partition over here. We call them as interatrial separation or interatrial septum formation. That is what we are going to talk. So, this is septum number 1, and then we have this particular septum which is going to form. So, this next phase we are going to talk about formation of interatrial septum. So, this particular interatrial septum formation comes in formation with the series of things happening. So, first we see that from this particular roof element there develops a tissue which inches towards this particular endocardial cushion. So, this particular endocardial cushion gradually solidifies, and this particular thing which develops from the roof of this particular atrium more or less in the middle portion drops down. So, this particular roof which is a muscular tissues or kind of mesenchymal tissue which is dropping down, we call them as septum primum. Now, as the time progresses from here it grows farther down. So, it develops into this. In the second phase it develops into develops down and going to touch to this particular element, we call them as endocardial cushion. Now, if this particular septum primum which is developing from this atrial chamber can touch this particular endocardial cushion, we achieve a partition between right side and left side. But what happens over here, as this particular septum primum drops down and going to touch this particular thing which is known as endocardial cushion, which is formed between this atrium and ventricle at the region of AV canal, we see that there is a breach or a hole appears in this particular septum primum. So, this particular septum primum is going to touch to this particular endocardial cushion, it achieves that particular touching point, it touches this, but meanwhile this particular region takes a breach. So, it makes a kind of hole in between. So, this particular top part is present, then we have a hole, then we have this particular further part of the septum primum. Now, this particular hole which is created out here, we call them as foramen, and this particular foramen we call them as foramen ovale. So, this particular foramen ovale is there. So, we have an incomplete partition which is developed from this septum primum. So, septum primum was going to make this particular atria divided into right half and the left half, but inefficiently done as because it loses some of its tissues in the middle portions, creating a hole. That particular hole we call them as foramen ovale, right. Now, as we have this particular hole develop, the system develops it like we have a kind of breach in here. So, they have to breach this particular element. So, they create a secondary membrane or secondary element. To cover this, from this particular wall itself, there develops another septum or another partition. So, this is number 2 or septum number 2. We call them as septum secundum. So, this particular septum secundum is about to touch to this particular element which is known as endocardial cushion, drops down, should be touching like this. But what happens, it do not have that much of mesenchymal tissue left. So, it cannot reach to this particular part. So, only thing, it covers more or less the entire length of this particular cavity of foramen ovale. So, we have a septum which is septum primum which is present, septum number 1. Then we have this particular second septum develop into this particular atrial chamber. We call them a septum secundum, which intends to cover this particular foramen ovale and reach to this particular endocardial cushion. But it do not have enough ration to reach to this particular part, rather it ends into forming a hanging chamber or hanging curtain like this, covering this particular foramen ovale. But it incompletely divides this particular right atrial side with the left atrial side with a hole inside to it. Now, what happens with this? The blood which is present in this particular right atrial chamber can leak through to the left atrial chamber. So, it has a passage of blood from this right atrium to this particular left atrium because having this particular opening which is present. So, this thing happens before we are born. Now, why this particular right atrial side blood moves to the left atrial side? Because the pressure of the right atrial side is 10 and left atrial side is 4, for example, when or before we are born. So, blood moves from higher chamber side or higher pressure side to this lower pressure side. That is why there is a blood is going in here. This thing we call them as, in a medical words, as shunt, S-H-U-N-T, shunt, shunt of blood or shunting of blood from the right atrial side to the left atrial side through the foramen ovale. So, these things we call them as R to L shunt before we are born. That means it is happening in utero when we are still in the uterine cavity. Clear? Now, what happens after that? After we are born, the pressure gradient shifts, the lung becomes open and it starts functioning. Once this lung becomes open and function, this particular left ventricular side and right ventricular side shifting of pressure gradient is there. The right atrial side pressure becomes 2 because of lung is open now, it takes air, all the water or everything is gone out. So, this particular chamber right atrial side which is going to lung is now pressure drops to from 10 to 2 and this side is 4. So, left atrial side is on a higher pressure, right atrial side is in a lower pressure. So, what happens then? There is a shunt reversal. That means blood is not flowing through this particular side from this side to this side. So, as this particular reversal is going on, as this thing is going reversal over there, so blood cannot flow through this particular part, rather it is going from this atrial side to this side and going on. So, this particular shunt is not working anymore and there is a shunt closer. So, as this particular element is closing, this particular blood is going to this particular atrial chamber and going out, this particular element is gradually breached and this particular septum secundum breaches with this particular septum primum and makes this particular open foramen becomes foramen ovale becomes a united gap. So, this particular gap which is foramen ovale becomes fused and makes this particular depression over there which is present as a depression in the interatrial chamber. So, this particular foramen ovale is no more there as because this particular septum secundum joins with this particular septum primum, the upper part and lower part, and resulting in formation of interatrial septum. So, this particular interatrial septum, we have this particular thing made by this particular 3 element contributing to it, forming this particular entire thing. So, we achieve a completion of this interatrial septum formation by this particular closure of this shunt once we are born, because of this particular reversal of this particular pressure and this particular heart and lung, everything is functioning. The flow dynamics changes from the left atrium, it is reaching to this right atrium and left atrium, going from this particular lungs and so on. So, there is a reversal of the shunt leading to this particular fusions of this particular atrium, and we achieve an interatrial septum. So, this is how this atrial chamber of right side and left side got separated. So, initially what we have, or what you had, this particular septum primum which is present, and then we have this particular thing which is foramen form over here, which is foramen ovale, then secundum foramen secundum which comes in here, bridges this particular element covering this, and foramen ovale is bridged by this particular septum secundum after we are born, and this particular entire thing which is achieved by this particular presence of this particular thing, we call them as foramen ovale, which we have this bridged by this septum primum and the septum ovennum, and the shunt is closed, septum secundum and septum primum is making this particular element. Foramen ovale is not there, we get this depression as fossa, we call them as oval fossa or fossa ovalis. This fossa ovalis is present in the atrial chamber or interatrial chamber in this adult part. So, before birth this was there, we have this particular two membrane coming in here, and after birth we have this particular septum secundum, septum primum fused together, making this particular patent foramen ovale to this to the formation of this fossa ovalis or oval fossa. So, this is how this particular story of interatrial chamber is formed, and we achieve a right atrial chamber and the left atrial chamber. So, this entire story of formation of the septum is important in case of the atrium. Now, if we have any trouble in formation of this, any of this, that means septum primum or septum secundum is not properly formed, we get this particular condition where we have this foramen ovale is not fused, and leading to this particular opening patent as patent foramen ovale. Also known as ASD, that means atrial septal defect. That means if we have this partitioning not properly formed, we have this particular foramen patent, and that particular foramen patent we call them as patent foramen ovale, also known as atrioseptal defect, or in short we call them as ASD, atrioseptal defect. So, atrial septal defect may be arising if you have this particular falsely formed septum primum or septum secundum not fusing properly after birth, leading to this particular clinical condition we call them as ASD, atrioseptal defect. In short, we also can call this patent foramen ovale, where this particular foramen ovale was not fused at all. So, it remained with this particular foramen, and then this particular shunting of the blood can happen if we have a pressure gradient change. So, this is a kind of developmental error. So, clinically we give this particular question about a patient having a septum primum defect or septum secundum defect having this particular ASD. So, this particular formation or pathogenesis of ASD or atrioseptal defect or patent foramen ovale, how these things are coming. So, you have to just like elaborate the whole thing, like how this particular septum primum was there, how this septum secundum is there, how this particular fusion takes place after birth, and if this particular fusion not properly taking place because of the either faulty the septum primum or septum secundum leading to this particular foramen ovale patent, we call them as patent foramen ovale or ASD. So, this ASD thing is our exam question. So, you have to explain it with your embryological knowledge how this particular ASD is formed or how this ASD is making sense. So, this is what we have to know. Now, coming back to this particular region of development of this AV canal or this particular septation or septum endocardial cushion. Now, this is what we talked about beforehand. So, we have this particular region which is lying here in between this AV canal region. So, AV canal initially was like this common atrioventricular canal where we have this particular no chamber formed. So, what we have seen that we have this particular bump coming up like above and below, this particular bump which is coming up and below, above and below and joining here and making a partition in between right side and left side. So, this particular midline thing we call them as endocardial cushion that we have referred in the initial part. This endocardial cushion which is the first thing of the foundation of this ASD or atrioseptal or atrium septum or this ventricular septum, we can call this as septum intermedium. So, which is kind of like a partition which is taking place at the beginning where this particular endocardial cushion. So, this particular guy which is endocardial cushion, if you cut section of this is this one. So, this endocardial cushion, the other name of this endocardial cushion is also known as septum intermedium. So, this endocardial cushion is an important element. If you have this particular endocardial cushion not formed properly, we may have this particular formation of this septum not formed at all. So, to summarize this thing, how can we have this particular ASD or atrioseptal defect or this particular patent foramen ovale kind of things? So, the causes or reasons what may have caused this ASD or atrioseptal defect causes. So, cause number one is that things if we have faulty formed endocardial cushion. That means the primer thing which you are talking here, endocardial cushion is that also known as septum intermedium. If the septum intermedium is not formed, which is this one, is not formed, that can lead to ASD. That is the one thing. Second thing is that you have faulty formation of septum primum. Third cause could be faulty formation of septum secundum. So, we may have a faulty formation of the endocardial cushion, we may have a faulty formation of septum primum, we may have a faulty formation of the septum secundum, or the combination of all these things, three things may have gone wrong that can lead to. And number 4 is that we call them as incomplete closure of patent FO, foramen ovale. That means that foramen ovale that was closed by this particular septum secundum may have partially closed. So, may have a small gap left. We call them as probe patency of foramen ovale. That means it is not a big gap, it is a very tiny slit may be present. We call them as patent or probe patency of foramen ovale. So, this ASD, how this particular ASD could have caused, this is the thing that you have to keep in mind whenever you are addressing. So, we have this particular endocardial cushion that we have talked about, how this endocardial cushion is there between this AV groove, atrioventricular canal is there. So, this particular growth which is endocardial cushion is growing and forming this middle thing. So, if this particular middle portion which is not formed at all, endocardial cushion, if this endocardial cushion is not there, So, this particular septum primum or septum secundum which was going to anchor into it, it's never have an anchorage to it. So, these things if absent, we have a problem. If the septum primum is not formed, we have a problem. If the septum secundum is not formed, we may have a problem. Third thing, it could be all three together not formed properly, we may have a complete absence of this partition, that could be a possibility. Other thing is that this particular foramen ovale that should be closed after birth may have a tiny slit, we call them as incomplete closure of patent foramen ovale. That means a tiny slit may be left over here, not bridging the whole foramen, leaving some kind of blood emptying into it or passing through it. So, this is the reasons of ASD that you need to understand, that you need to form. So, ASD or atrioseptal defect is the thing that you have to prepare really well for your examination, and the reasons for ASD, that also that you have to keep in mind. So, from this particular septum, we are going to make another septum which is present in here. So, right side and left side atrium we have achieved. Now, what we are going to do, we are going to make a partition in the ventricle as well. So, we have this atrial side, we have the ventricular side which is there. In between them, we have this particular endocardial cushion. This endocardial cushion is very important word that you have to keep in mind. Endocardial cushion, also known as septum intermedium. This is the foundation key. That means, if this endocardial cushion is not formed or septum intermedium is not formed, there won't be any atrial septum formation, there won't be any ventricular septum. So, this guy which is formed in here, which is bridging between right side and left side, this beginning thing, if it is not formed, we have nothing at all. So, this number 1 is remains number 1 throughout it. Keep that in mind. Now, next to we are going to form a chamber between the right side and the left side ventricle in this region. So, this particular ventricle or interventricular septum have got two parts of it, develops from two sources. It develops from muscle, or it has a muscular part, and it develops partly from membranes, it has a membranous part. So, it has two components, some of them is developing from muscle and some of this ventricle is going to form from a membranous part. Just like ASD develops from primum, secundum, cushion, this also develops from different parts. Now, we are going to learn about how this particular muscular part is developed and how this membranous part is developed. Now, as this particular development of these walls going on and as this particular heart is developing, we have this particular ventricle chamber which is developing some muscles. So, it is developing some kind of muscles, and from the apex of these particular muscle portions, there appears a bulge reaching towards the endocardial cushion. So, this endocardial cushion is the prime thing which is towards it, it has to grow. So, anything which is going in here above or down has to reach to this particular number 1 positions or endocardial cushion. So, this particular region we have this particular muscular part of interventricular septum develops from the muscles of this ventricular chamber itself. So, this develops on here, number 1 part is this one, we call them as muscular part of interventricular septum which develops from the muscles of ventricles. Now, what we have to do? We have to create some membrane out here to bridge these things to the endocardial cushion and joining with the muscular part, then we can achieve this particular ventricle separated by this right side and left side by this particular septum. So, we have to make this particular element to develop. So, this membranous part of ventricular septum defect. So, this membranous part of this ventricular septum is the most tricky part that we have to understand how these things are developing into it. So, this membranous part of this ventricular septum develops from two sources. One thing is that the endocardial cushion ECC or septum intermedium that contributes it, and we have another element we call them as bulbar ridge. These are the two things that contributes to the membranous part of the ventricular septum. So, this ventricle septum develops from two sources, one is muscle, other is the membrane. The membrane is developing from this endocardial cushion and bulbar ridge, and we do not have any idea what this bulbar ridge means to us. That is what we have to learn little bit about septation of this truncus arteriosus or atrial chamber arterial septal formation. Now, we have the aorta and the pulmonary system. Now, this aorta and pulmonary system develops from that part. We call this as truncus arteriosus out here. So, we have to go back to this particular picture where you see that, right. Now, we are going back to this particular same old picture where you have this particular thing present. This truncus arteriosus and the aortic root, these things develops into the pulmonary artery and this particular aorta which is coming in here. So, we have this particular heart picture. So, we have this particular pulmonary artery and aorta, and you can see that this particular thing is winding in each other, that means they are spiraling on. So, they are having this pulmonary artery and aorta, both of them developed from this truncus arteriosus portion. Now, what happens in this truncus arteriosus portions, they have this particular thing is separated also. So, this particular truncus arteriosus is separated by a partition, we call them a spiral septum. So, this septations over here is spiraling or looping around. So, what happens in here, we have this particular bulbus cordis and we have this truncus arteriosus. So, this bulbus cordis and this particular truncus arteriosus, inside to it shows some the ridges, we call them as bulbous ridge or truncal ridge. And how do these things look like? They look like this. So, this is what we are going to make from this particular aorta and this pulmonary artery. They are winding against each other. Where from they are developing? They are forming on this particular truncus arteriosus and bulbus cordis above part. Now, we see that in between this particular region there appears some kind of ridge. We call them as the bulbous part, we call them as bulbar ridge, and this upper part on truncus part we call them as truncus ridge. Now, this bulbous ridge and this truncus ridge, right side and left side, they fuse and create a septa. We call this septa as spiral septa. So, as the time progresses, this particular ridges joins in the midline, right side, left side, right side, left side, and they join over here. And this particular septations or this particular joining is not a straight line joining. It joining not like this. They are spiraling like this. So, as this particular element is spiraling around, they create this particular part which is making this particular septa. We call them as aorticopulmonary septations. So, spiral septa or aorticopulmonary septa is making into this particular bulbar ridge and this particular conus ridge over here and truncal ridge and joining to give rise to this particular whole thing. So, this particular partition as you see here is looking like spiral like this. So, this partition, spiraling partition, makes this particular aorta and this pulmonary artery looks like this, wing like this. So, this is how it is formed. Now, why I am spending this time? Spending time on this particular ridge. So, this particular ridge we are focusing here is bulbous ridge. So, this particular bulbous ridge is present in here around this particular region. So, this particular bulbous ridge or bulbar ridge along with this particular endocardial cushion, So, this bulbous ridge along with this particular endocardial cushion which is present in here makes this particular membranous part of interventricular septum. So, this particular second part also known as membranous part of interventricular septum develops from two elements, endocardial cushion and bulbous ridge. What is bulbar ridge? That is the thing which you are refer here. So, that bulbar ridge is a partition element for the aorta and pulmonary or aorticopulmonary septus. So, this particular bulbar ridge and this particular endocardial cushion makes this particular interventricular septum. Now, coming again, if we have this particular bridging of this particular membranous and muscular portion of this interventricular septa falsely formed, we get a disease or we get a developmental defect, we call them as VSD or ventriculoseptal defect, just like atrial septal defect. Now, what could be the causes of ventriculoseptal defect or how this particular VSD can be caused? Number one, we have a defect in membrane formations and defect in muscular formation. So, we have this particular muscular septum which is developing from this ventricle falsely formed or not formed. That could be one reason. Second reason could be we may have a membranous portion not joining with this particular muscular portion, that can lead to this particular formation defect. So, membranous error or membranous septa formation error. So, this particular membranous septa is developing from that part which we call them as endocardial cushion. So, we may have a defect in endocardial cushion defect. Fourth thing, it could be the bulbar ridge. So, that bulbar ridge may not have contributed to the formation of the membranous part. So, this may have this particular causes of VSD. It could have a error in the muscle formation, it could have a error in the membranous septa formation. It could have a problem in this particular endocardial cushion part of this membranous septa formation error. It could have a bulbar part of this particular membranous septa error formation. It could be a combination of this. So, a VSD can be of two types. There may be a muscular defect or a membranous defect, or could be mixed of this. That means, everything could be possible, both membranous and muscular defects may be there, and each of these defects are contributed by these three elements. Either this particular membrane is falsely formed or these muscles are falsely formed or mix of things. If the membrane is falsely formed, it could be of two types error. That means, endocardial cushion or septum intermedium that may have falsely formed, or may have a bulbar ridge which is contributing to the formation may have falsely formed. Second thing is the muscular defect. The ventricular muscle which is coming from the chambers of it may have a partially absence or partially formed, then may have a gap like this. So, this particular gap or incomplete partitions may be there and blood may be shunting between these two things that lead to this particular problem. We call them as ventriculoseptal defect. So, this particular ventriculoseptal defect and this particular atrial septal defect are very important clinical question that we see in our exam questions. So, this particular VSD and ASD, this particular element is kind of very important. So, ventricular septum develops from two parts, muscular part and membranous part. Membranous part develops from two sources, the bulbar ridge. What do you mean by the bulbar ridge? We know that. And endocardial cushion, we understand what do you mean by the endocardial cushion. And muscular part is developing from floor of this particular muscle or ventricle itself. So, these three joining together making this particular whole interventricular septum. Any of these three goes wrong in fusion or formation can leave a defect in here. That particular defect, in short, we call them as VSD or interventricular septal defect or ventricular septal defect. that can lead to shunting of the blood right to left, left to right, depending on the status of this embryo before birth or after birth. So, VSD and this particular ASD, how they are formed or how these particular things are caused, they are very important clinical question that we must prepare for examinations. This is what we have to come to here. So, this is what we are summarizing over here. This particular interventricular septum have got three things which is coming in here: membranous part developing from here, bulbar ridge which is contributing to the above part, and this particular lower part is coming from the endocardial cushion, and lower part is coming from the muscle which is coming from below. So, this particular element which is coming from above part or membranous part uppermost position is coming from the bulbar ridge, uppermost portions, intermediate portions coming from this particular region, we call them as interventricular or endocardial cushion, and lower portions of this particular septum is muscular or truly muscular. Now, as we progress to these higher classes like pediatrics and the pathology, you will be learning the sub varieties of it. There are sub varieties of these particular classifications are there, and the clinical presentations will be likewise depending on how this particular defects is there: small defect, large defect, intermediate defect, membranous defect, muscular defect. They are different, and depending on how these defects are, we have to give a treatment to it. So, the surgical corrections if it is required, or any other kind of like a medical problem that is arising out of it. So, these two things that we have to keep in mind regard to this particular septal formation. So, to summarize once again where we have started, this particular thing which was there is only single thing. The first thing is that development of the intermedium septum or septum intermedium or endocardial cushion. Endocardial cushion develops at that particular region, we call them as atrioventricular groove. At that region we have this particular cushion developed from the mesenchymal tissue. If this things is achieved, then we achieve this particular right side and left side differentiated. Once we have this particular nodal thing which is placed in the middle of it, we can draw this particular membrane or partition right side and left side, making this particular heart split into 4 chambers from here, from the atrial side and as well as from ventricular side. And both of these occasion, this endocardial cushion which is the prime thing contributes. So, in case of the atrium, we have this thing which is coming from the roof, we call them as septum primum, which is dropping down to the endocardial cushion, fails to reach to there. In meanwhile, this particular thing breaches in here, creates a gap, we call them as foramen ovale. Then comes with the second septum, we call them as septum secundum, which drops in here, covers to bridge to this particular thing together. So, if we have this error in this primum, secundum or endocardial cushion, any of this goes wrong, we may have a defect present which is known as being on ASD. Similar to it, we have this particular endocardial cushion and this septum which is present in between the right ventricle and left ventricle, we call them as interventricular septum. Now, interventricular septum which is present in here have got two parts, membranous part and the muscular part. Muscular part develops from these muscles of this floor of this particular ventricle chamber, which climbs up reaching towards this particular endocardial cushion. Now, endocardial cushion forms this particular membranous part with help of the bulbar ridge. The bulbar ridge where from it is coming we have talked here. So, this bulbar ridge and this particular endocardial cushion contributes to this particular membranous portion of this particular septum. Now, if anything goes wrong in the membranous part, in this particular muscular part, we get a kind of defect, we call them as VSD. It could be a muscular defect, it could be a membranous defect. If it is a membranous defect, it may be yielding of endocardial cushion itself or this particular bulbar ridge or a mix of things. If we have this particular partition incompletely present, we get this particular disease as VSD or ventricular septal defect. Now, the complex thing as we have seen here, we have this particular septum which is arising in between this particular truncus arteriosus, we call them as spiral septum. The spiral septum is spiraling out and this particular spiral septum is spiraling around, splitting this particular truncus or conus arteriosus into two parts, this particular arch of aorta and pulmonary artery. Just like talk about this particular element which is splitting in here, where from this particular thing is coming, how this complex spiraling is going on, we are not going to talk detail about it, but know this particular ridges we call them as truncus ridges and the bulbar ridges, and these particular truncus ridges and bulbar ridges joins in the midline makes a spiral septum. This particular spiral septum which is present between this aorta and pulmonary trunk, we call them as aorticopulmonary septa, also known as spiral septa. So, spiral septa, aorticopulmonary septa, these are the two names that you have to keep in mind whenever you are studying it. Detail of the septations on this particular aorta and the pulmonary things we do not have to know. Only thing we have to focus on VSD and ASD and what are the causes of it. So, prepare these two things very well, and we have some other vascular errors as well. In the final day we will talk about those things, but for the day prepare the VSD really well and ASD really well, causes of it and how these particular things can be complicated with terms of diseases, etc., etc. Good? Clear with this ASD and VSD? You can make it out, simple words, do not go into deep digging, just know about how these particular steps are on formations, and that is it, alright.